Welcome to episode 2 of Inside Insights. I'm Chip Truitt, and today we'll be talking with Dr. Alexandre Gonçalves, Medical Officer for Cardiology and Personal Health here at Philips. Each episode, we bring focus to one of the 4 horizons of precision diagnosis: smart diagnostics, optimized workflows, and integrated diagnostics leading to clear care pathways with predictable outcomes for every patient. Today is no exception. I hope you enjoy my conversation with Dr. Gonçalves. Dr. Alexandre Gonçalves, welcome to Inside Insights.
Thank you. Great pleasure to be here with you, Chip. Thanks for having me.
It's our pleasure to have you join us. As you know, Dr. Gonçalves, many trends in healthcare have been at play over the past decade. In the U.S., the Patient Care and Affordable Care Act, the so-called Obamacare of 2010, is now 10 years old. The COVID-19 pandemic of 2020 has impacted most of the world, unfortunately putting many important populations at risk, not only from COVID-19, but from the unfortunate care delays incurred by safety and risk constraints related to COVID-19. Those with chronic diseases, as well as those with both undiagnosed and diagnosed cancer, have been in a sort of medical limbo for the last 8 months. While the pandemic has taken many lives, it's worth remembering the many healthcare heroes that have given so much time and energy to rescuing as many people as possible from the ravages of COVID-19. The pandemic has upended the status quo for healthcare systems, healthcare workers, and patients across the world. From your clinical perspective, how is COVID changing and improving the way healthcare is delivered?
Yeah, Chip, that's really a great question. We all lived through this transformational change in the last 6 months, and we are at a moment of actually looking how it can improve the healthcare towards the future. So it's the best that we can do from a crisis. And as you were mentioning, the access to healthcare was definitely challenged during the pandemic, and challenged by the scope of the disease itself, by being an infectious disease. And so for those that actually had COVID, what was the access that they could have to the system in a safe way for them and for the others around them, and also for other patients that didn't have COVID but needed healthcare support. And that was for the first time in our history. We saw a drop in March of 2020 of more than 40% of the patients coming in for elective procedures and even for emergency procedures. So in the cardiovascular realm, which is the place that I connect most as a cardiologist, even acute myocardial infarctions had a huge drop in the data that we now have access from Europe and from United States. And that still has the scope of a mystery. Why acute MIs went so low? And at the beginning, people were saying, oh, perhaps because we're staying at home, because there's less level of stress of moving around. But then we started to see patients coming later with the complications. So they were actually happening, but they were not getting the healthcare they needed. So while we lived through this, and now at a time of wanting to make sure that people feel safe to come back to the hospital and to get the care that they need, and that whatever we call elective today can be an emergency tomorrow. And that is very, very worrisome. That can draw us back decades of the advances that we have been doing in prevention and in timely care of any given situation. And especially in what concerns to cardiovascular disease, elective is a word that applies to a certain extent. The elective today, it's not elective tomorrow. So people have to be really mindful of that. And to that end, how are we seeing the change? We are seeing the change has a huge transformational happening in such short amount period of time. And that's the amazing and the positive that we hope to continue to see for the future. And that happened within telemedicine. We recognize that big hospitals changed their way of working within a week. Within a week, they went from 100 consultations using telemedicine to hundreds or thousands. And that's absolutely unbelievable. And that brought to light that things can be done differently. And we had a small segment of the healthcare leaders bringing that voice along for a long time. And suddenly that voice became the reason to actually perform this change. And it's amazing to see that skepticism that we would see, oh, that's not feasible to do remotely, that we have to have the patient in. Suddenly that sense changed, and it became, in a lot of different circumstances, more effective to the patient. So all the efforts were put more around the patient and what was the right thing for them, and not so much with the hurdles of not being so convenient for the institution or for the other stakeholders in the way.
I think you hit on a couple of really interesting points. And in particular, this telemedicine thing, for 10 years, people have been trying to ramp this up, and everybody's been hesitant. They're not convinced that it's going to work or whatever. But, necessity is the mother of invention, and clearly the necessity drove this, and with unparalleled speed, this ramped up, as you pointed out. It'll be interesting to see going forward how much of the telemedicine stays and how much recedes once we open back up. My suspicion is we're going to see a lot of it stay. And it's also enabled us really to have a whole new outlook on patient participation from the home and from remotely that we had not seen before. Further, in digitized care or digital care, we've seen so many things advance, and one of them, also near and dear to you, is the use of Lumify with Reacts and how that's transformed care going forward. Do you have any thoughts on how important that's been both in COVID and post-COVID?
Yeah, so thanks for bringing that question, because again, back to what we were talking about the needs being there, but the action not being addressing those needs. The same, to a certain extent, happened with Lumify and their use at emergency care. So when we first start to seeing people asking for the use of ultrasound in emergency care for the assessment of the heart and the lungs, for some was a novelty, but for others was not, because it was already a recommendation for patients that were with shortness of breath coming for an emergency room to have an assessment using ultrasound in case that ultrasound was available. But unfortunately, most of the times they didn't have that resource at the emergency room, neither they had the expertise. But suddenly it became really the unique tool for bedside assessment. And that meant that the patient wouldn't have to be moved anywhere else, and that the physician that was actually evaluating the patient could complement that evaluation with the ultrasound assessment. So that brought to light what ultrasound can do in the shortness of breath evaluation, which should be applicable, and it was already described as being the way to do it for later on in the future, so very much beyond COVID.
Let me switch a little bit. I mentioned earlier that healthcare heroes, have been the focus of a lot of people's attention, and rightfully so. I think what this focus is that people have seen this renewed sense of purpose that maybe had faded from their everyday lives. So can you address what one aspect of healthcare would be most impacted by this renewed sense of purpose towards the patients, towards the care they're giving, and the way of working is?
Yeah, I think COVID brought us to light our all vulnerability, and that any of us is a patient, and that our sense of interest has to be focused in that being the main focus, has the patient is first and above everything. And we could see that reinvented in industry, in academia, in the clinical world, because suddenly there was a common crisis that we were all together to solve. And I've heard this from my colleagues working at the hospital, that they were saying there was no hurdles of this is not what best suits my department, this is not where I want to see us going as a strategy. No, that was like, this is what we have to do and do it now. So just let me know how I can help. And within the industry, I felt the same within our own company and in others that we have discussions with. That was very clear our role, that we are here to help to save lives, and that's what we do every day outside of COVID. But COVID highlighted how we were going to do that. It made the path really clear, especially at the beginning, understanding that there was more of a need, an emergency need of CTs, of ultrasound machines, of ventilators. And we had to be fast in that delivery and efficient and with the quality that we always bring. But suddenly I feel that what happened with COVID is that we as human beings have always in the background some selfishness, and this took away that selfishness and made us lean more towards the common good. So that's the takeaway of it, and I hope that we are all smart enough to be able to continue that route in the future.
I think you make a really good point. I gave a talk to the American Society of Neuroradiology a few months ago, and I ended the talk on this very point, that we're all focused on this common good now during COVID, and that silos have been broken down across the healthcare system, as you mentioned before. In my time at Philips, I saw a dramatic shift in this regard, led by Franz and leadership, that we needed to really drop the silo thinking, and the whole company needed all oars in the water moving forward to mobilize the resources of this company. And as I pointed out on my final slide to the ASNR, I'm blown away by how much this company has pulled together, as you pointed out. And it's both the healthcare heroes on the front line and it's places like Philips on the back lines that are doing that. And hopefully we will be able to carry this forward post-COVID.
Absolutely. And even more than before, hand to hand. So we have to be the trusted partner, and we are. We are the trusted partner with healthcare institutions. And the way to do that is to be really providing the solutions that make the difference, and that is on the top of our mind. So when we provide a faster and more accurate way of getting access of data through our ultrasound systems, our CT, through our digital platforms, throughout providing the devices for people to stay at home and being monitored with a partnership as we have just done with BioIntelliSense, and having that understanding that the need of being at home now and providing information to the healthcare provider and to the patient himself became more important than ever. And when I say this, what I mean is that the importance has been there, but now there's an added reason to actually avoid some exposure to what can be environments of potential risk, even with the best effort of minimizing the risk outside of our homes. So that's very unique.
I think COVID has brought an urgency to things that were obvious and important, but were not being enabled. Anyhow, it's been a fabulous and interesting discussion. Thank you so much for listening. And Dr. Gonçalves, once again, thanks for joining us here.
My pleasure. Thank you for having me.